So we are Kaleidoscope Health and Care. We are a not-for-profit organization, and our purpose is to spread kindness, connectedness, and joy. One of the ways that we do that is by providing consultancy services. We provide those in several areas. If we could go to the next slide, please. So we provide support in research and evaluation, which is the team that you're going to hear from today. We also provide support around collaborations and systems, around organizational development, around service change, and for strategy development. If you think that we could help you in any of these areas, please feel free to be in touch. You can contact us through our website or contact me directly. And again, my email address is in the chat, andrea@kscopehealth.org.uk. Our agenda today is really to make sure that you come away with a stronger understanding of what qualitative research is and how it can be a powerful tool for measuring impact, as well as having some real life examples to help make that more real and more concrete, and some top tips on how you can do it well. As I said, we're going to hear from 3 speakers, Joe, Gavin, and Sarah, and we'll have some time for Q&A, and then we will close with next steps and reflections. So if you, again, could go to Menti, it's in the chat, and tell us, just so we can get kind of a base level understanding, if you could rate your current comfort level with using qualitative research and qualitative data, from 1, which is absolutely not happening, I hate it, to 10, which is I live and breathe qualitative research and data. Just go ahead and pop your vote in for where you are right now. Right, so we're seeing it move in live time. Looks like we're at about a 6 as an average. That's great. That is that's over 5. So excellent. That's a really strong starting point. We're going to ask this question again at the end, and we'll see if we can move the dot at all. All right, great. So if we could go to the next slide, please. When you registered, we asked you what you hoped to hear and learn about today. And the comments that came in that were really helpful, they largely grouped around these 4 key areas. So the first one is, how can qualitative research help me measure impact? The second is, how can I do it well? There were also some questions around, how can I convince other people that it's valid? And finally, a question around, how can we do it efficiently? So we're going to address all 4 of those today. And first, I'm going to hand over to our first speaker, Joe, who is a part of the team at Kaleidoscope. Joe is an evaluation expert here at Kaleidoscope and has particular expertise in designing frameworks to measure and understand the impact of health and care interventions. And he is a champion of co-production and user-led research. And he's going to talk to us about what qualitative research is, why it's important, and how we can do it well. Over to you, Joe.
So what is qualitative data and why is it so great for measuring impact? So qualitative data is any data or information that is not numerical. It's the perspectives of people involved, the staff, the patients, the end users, the population, people involved in your intervention, organisation or programme. It's their voice. And we like cold hard numbers to describe change or an impact, but we also really like to hear from real life people. And there are many strengths and benefits of qualitative data. So it tells us the what, the how, and the missing pieces of the puzzle. So it lets us know what causes success, and it gives us the specific context of why things work in a specific condition. And it helps tell that story of change. And this is essential if you're wanting to do more, better, or do the same thing somewhere else. And it will let you know which critical pieces of that puzzle to invest in. And most importantly, it gives you hard, reliable evidence and learning. And we'll be talking a bit more about that as we go through today. On to the next slide. So subjectivity and collaboration. And subjectivity is key. Trusting and valuing the subjectivity of your data is really important. Your stakeholders are individuals who have real perspectives of their environment, program, or organization, and capturing their perspective through qualitative research allows you to understand the real picture. It helps you move away from groupthink, either sort of a pressured consensus or towing the party line. And on the flip side of that, when thinking about the subjectivity of our researchers who are carrying out the qualitative research, we build systems of quality assurance and trust the experience and ability of our team to remain objective. If anything, humans have a bias to the negative, so we often rely on someone else to be able to pull out those threads of success. And Sarah's going to be talking about this a little bit later in some of the processes that we use to ensure rigor, reliability, and accuracy in research. And speaking to people gives amazing opportunities as well. We see research projects as a relational process. So we use our contact with stakeholders as a way to strengthen your connections, build relationships for yourself between your stakeholders and between your stakeholders. And it ensures mutual understanding of your work down the line, not just at the point that you're doing the research. And from this, at the end of your project, or as our project, as an additional output, you've created a network of engaged stakeholders who are invested in your work. Additionally, we like to bring in stakeholders into the qualitative work to really get that buy-in. Involving them in the analysis phase, testing and validating findings, engages them and gets buy-in with the results and the so what does this actually mean, the research that you're producing, and create shared ownership of your reports. If we head on to the next slide to talk a little bit more about impact and understanding impact. It's great to ask both about the specific impacts that you're looking to see, to what extent has the change happened, and who or what can that change be linked to? What specific activity done by who causes which change? The stuff that you've started out from your research project to understand. But equally important is the open-ended stuff. It's important to always give your stakeholders a chance to talk to you about any unintended consequences, any other examples of impact they think are important to include, or conversely, where things went wrong. Where something negative happened as a result of the activities that we do through our work. So your people are the experts, and that qualitative research gives you the space to rigorously explore those unexpected areas, and holding time for that is really important in projects. I'm going to run you through some examples of how we've used qualitative data to describe impact. We head on to the next slide. So expressing how change happens can be a really useful outcome of qualitative research. So this is a stripped back theory of change that we produced with the client. I removed quite a lot of the detail for this, but through qualitative engagement, we co-created a document which shows the change the organisation is trying to have, their outcomes, their impact, and the activities which are driving that change. And now they're using the full version of this to inform their strategy, where to focus resources and the direction for the organisation. But this sort of information can only come through conversations, interviews, focus groups with those key people in those organisations. Moving on to the next slide. One interesting way of being able to use qualitative information is this example from our work with versus arthritis. We produced maps from our engagement that presented the spread of their champions involved with their network. The lines there, and the detail isn't so important, but the lines show the personal connections between stakeholders, and the colours show the profession of the individuals involved. So this output of that report, it became a useful tool for them to understand how to engage, influence, and communicate with key stakeholders. But this is something that we built up as we went through the research project, as we made those connections to individuals and found out from people who their key connections were. Looking on to the next slide and thinking about content and reporting, qualitative data really lends itself to engaging content. When we worked with Ockley's NHS Foundation Trust, we used qualitative method to collect case studies and then transform them into video content. It's easily shareable. I mean, it literally speaks to the people you're trying to reach, and your comms team will love you for it. They love getting interesting and exciting material that they can share with people. But yeah, qualitative tools give you some interesting, flexible ways of reporting your findings. And something that we hear often from people, if we move on to the next slide, is an important consideration around strength of evidence and reporting evidence with its strength, the finding, and how sort of corroborated it is, how to what depth it is, what breadth of evidence supports that finding is really important. This one on the screen is a straightforward example of how we categorize our findings to clearly show the strength of qualitative evidence. So here we've used a color-coded signposting system, and we use that throughout our report to clearly communicate the level of confidence in a finding to the audience. And that's going to be easily applied across different kinds of reports. Thinking more about some of the challenges, go to the next slide. Ensuring rigor and strong findings. We've talked a little bit about theory of changes, but Ensuring rigor starts with a really clear and reasonable theory of change, setting out what the impact is expected to happen and the plausible ways it will take place. A well-defined set of research questions produced on your theory of change, what you're trying to find out, what you're trying to test. This provides you direction for your research. You can then target your qualitative data collection so that every question you ask in an interview or focus group feeds back to your overarching objectives, and it gives you structure when you're conducting your thematic analysis of what do people actually say. Psychological safety. To build this in terms of how can people feel safe to give you honest and open thoughts and opinions, it's about setting clear ground rules, making sure that people know that words are private, being kind, that they won't be judged, and a couple of other tools doing icebreakers, helping people feel at ease and want to share their thoughts, and make sure you're balancing the conversation so that everyone gets a chance to speak and no one overrides the conversation. Ensuring inclusion and representation. People often talk about small sample sizes, expenses, and time resource that are required to do qualitative resource. And Sarah's going to be talking about this in more detail later, bit of a spoiler, but they are manageable, and qualitative evidence is so invaluable, it's worth thinking about at the beginning of your projects. How it blends with mixed methods is a challenge. To get around this, when you're designing your research framework and methodology, it's important to think about which questions will be best met by which tool and stagger your engagement. So, for example, your quant survey can be explored in more depth through your qualitative interviews. And then finally, applying critical thinking. So when you have your research team, when we get them together, we ensure that we can discuss, critique one another's findings, develop and elaborate together. An important tactic here is to make sure your data collection colleagues are also part of your analysis, so we can hold one another to account when we're drawing out those findings. We can check our own biases and we can check one another's biases. And there's a lot of popular ways of doing this, and you can find some of them online. If you head on to the next slide. For example, this is a tool to help your critical thinking. It's a cognitive bias cheat sheet. But essentially, as you're going through that analysis, as you're going through that write-up, you're asking yourself and you're asking your research team to think about, have we got too much information? Is there not enough meaning? Is there not enough time? Or is there not enough memory? So constantly challenging your findings as you go through that qualitative analysis space to make sure you have got that rigor and reliability. Now, I know that was a bit of a whistle-stop tour through what and why we think qualitative information data collection is so interesting. I'm sure Sarah's going to cover it in a lot more detail. But Andrea, I'll pass back to you.
Great, thanks, Joe. I'm now going to hand over to Gavin from Healthwatch, and Gavin is going to talk about a project that Kaleidoscope did with Healthwatch, a qualitative research project to help them think through the vision and impact, or the impact they were having, and whether they were meeting their vision, and then help them think through their vision for the future and what their organizational model how it might need to shift to have the impact they wanted. Gavin, over to you.
Thanks very much, Andrea, and thanks also to Joe. I think quite a lot of what you covered in there really sort of chimes with me, so hopefully we can see some of the linkages around that. So hello everyone, I'm Gavin Macgregor. I'm Head of Network Development at Healthwatch England, and yes, as Andrea said, we engaged Kaleidoscope to do some work with us around this particular operational model of Healthwatch, and I'll cover why we wanted to do that. Next slide, please. So as Andrea said, we really wanted to think about the model of how Healthwatch was set up and actually operates, and identify potential changes to address the operational governance and funding challenges that have arisen ever since we were set up back in 2013. So the brief that we gave Kaleidoscope was to gather perspectives from a range of stakeholders and identify relevant models that could really inform our existing Healthwatch model and explore the most promising options with us. So it's that's the detail of the brief. Right, next slide, please. I'll go through these quickly so you get time to chat. So just a little bit about Healthwatch. Normally, when talking about qualitative research, I would well, my colleagues would probably be talking about the sort of patient experience side of things. That's what we do. So this is very relevant to the kind of work that we actually do as Healthwatch, collecting people's experience of health and care to improve outcomes for people. And just a little bit about how we're set up. So we are a network, a national network of 153 local Healthwatch. They, out in all the different local authority areas, are independent social enterprises. They're commissioned by local authorities and they deliver statutory functions. And they now need to work collaboratively with an integrated care board footprints. So even within that little space there, you can see that we've got a number of stakeholders, the Healthwatch themselves, the local authorities, and now integrated care boards, and obviously ourselves and our sponsor department, which is the Department of Health. But we've also got other national stakeholders as well. And a little bit about Healthwatch England. We're part of legally part of the Care Quality Commission, but we're independent of them. And our role is really to take all the insight generated by local Healthwatch and have that sort of national policy influence role. But our other aspects is to provide advice to local Healthwatch and to local authorities. So we've got a number of functions in there. But stress it's advice. It isn't that we're commissioners. It's the local authorities that do that. Next slide, please. So the problem that we are facing is, like many organisations, particularly in the voluntary sector, there's unstable and reducing funding. So, and that's right across the board for Healthwatch and for Healthwatch England. And we also had strong feedback from many sources that there was considerable variation across the network in what actual Healthwatch do, i.e. the core services that they actually deliver, the quality of how they actually deliver those services, and that had been confirmed by previous independent research, for example, by King's College. As I said, we've got several stakeholder groups that we've got to look to, so we'd had lots and lots of views, more or less consistent, but there was quite a lot of noise in there. And so, just as Joe was saying around the importance of the relationships with stakeholder groups, that is absolutely crucial to us. And we're trying to have influence, probably with many of you on the call, actually, as well as other stakeholder groups. So maintaining these good relationships is absolutely critical, and we've got to take people with us. We had to move really quickly because if we are going to actually change the fundamentals of our model, because we're on a statutory footing, we would need an incoming government to change any, if we needed to change in legislation. And obviously the election was called, so we had to be prepared to move quickly. Next slide, please. So what Kaleidoscope did for us, again, very much echoing what Joe described there, they developed a research framework, but I'd like to stress they developed that with us but acted as a sort of critical friend. So you know, we used our limited resource really well, not to waste any of that, and I think that was a key thing for us, so really trying to work alongside them to get that right. And so we did challenge a few of the questions, but they kept their independence and gave you know, really good feedback as to why they wanted to do a particular way. They conducted a desk research to get a really good understanding of what the issues were, what already was out there, and there was plenty of stuff out there, almost too much, you know, in many ways. And then the qualitative bit that added the value really was particularly around these small group conversations, quite small, you know, small number, absolutely. But they were carefully chosen to try and get the mix of views of the different stakeholder groups, the three main ones being the local authority providers themselves, people actually doing the work, the people commissioning that, the local authorities, and this new group, the integrated care boards, who were, you know, within the last 2 years have engaged with Healthwatch and some less so. So we wanted to get all the different perspectives on that, and obviously ourselves as Healthwatch England as well. Next slide, please. So we asked them to just get straight to the point and provide us with a slide deck, really just presenting the analysis. So really using their sort of critical faculties about what they've actually heard and synthesizing that down. And they really did a great job on that. And for us, they set out and really confirmed, and it was great to see that set out, confirming purpose and impact, having heard from those different stakeholders. And they set out some of the challenges around that, but also set out how we could address those. And similarly, when it came to the commissioning and funding, again, they had synthesized all the qualitative research that they'd carried out, and again laid that really out very clearly in terms of the issues that needed addressing. And I'll come on to the recommendations later. And then finally, around the tensions within the current model, again, we'd heard lots and lots of tensions, almost too many tensions in the current model. And again, it was just being able to cut through that and say, these are the ones that you need to focus on. And that was the bit that really brought that home. Having, you know, they would have probably heard, they did hear much as what we heard, but it was actually getting that synthesis down around that. So they carried out a SWOT analysis of each of the recommendations, that potential recommendations that arose from this work and the options for moving forward. And again, what I just again speaking hearing what Joe was saying, they worked with our national committee and senior leadership team to really explore and test those particular options. So again, just really saying whether they resonated and whether they needed fine tuning, or how they actually landed. So that worked really well. Next slide, please. So in terms of the outcome, what we were really after was that independence and authoritative kind of piece of work. And although it's a small piece of work, it did really chime. So that when we actually shared that the report with local Healthwatch, it helped to inform the conversation, almost confirm the conversation, and confirm many of the issues that had been raised before. So that independence was really welcome. And our national committee had the sort of confidence to basically to take the decision to carry out more detailed work on what is quite a controversial recommendation around the commissioning arrangements. And it's a major change for something that's been set up in legislation. And also it's a springboard to being able to use the report to engage with other stakeholders. So we've been able to approach other stakeholders like the Local Government Association and our sponsor department, Department of Health, although you'll appreciate elections get in the way of these things, so I think the opportunity will become easier with a new government. So that's really a sort of springboard to being able to open up a conversation. It's not just us saying it, but other people have, you know, Kaleidoscope have confirmed that as well. And again, we'll actually wanting to seek to work with Kaleidoscope to build on those recommendations and use their expertise around the detail of a proposed new model. So should a legislative opportunity present itself. So much so we do see this as an ongoing kind of piece of work. Next slide, please. And so I just wanted to, for us, why Kaleidoscope? Well, we knew they had sort of credence in the sector, so that independence, being able to be a critical friend, bringing that objectivity, neutrality, and rigor to the fore was absolutely key for us, because we just needed to have that sound, neutral voice, being able to say what they actually found, and knowledgeable, because we gave them a hard brief. We didn't have a lot of cash, but and we didn't have a lot of time, so we needed to really think carefully about how we used that resource. And so I think because we were impressed with you know, their credentials within the sector, they were able to hit the ground running. Healthwatch, perhaps not the easiest thing to get your head around, but they really got us, and they brought that clarity and insight of the wider sector. So they were having to cover local authorities and the health sector, as well as all the intricacies of the voluntary and social enterprise sector. So that was really crucial. And as I say, absolutely pragmatic. They understood our constraints, time, budget, etc. And there was, you know, things happen, and so there was a lot of flexibility around how they worked. And yes, absolutely, they met deadlines. So we were really delighted with the output as a result of that, and it has been a really important piece of work for us. Okay, I'm going to stop there because I'm sure there'll be opportunity for questions and things later on.
Absolutely. Thanks so much, Gavin. It's really nice to hear such kind words about the work that we did with you, and we really enjoyed it. Our next speaker is Sarah, and Sarah is an evaluation expert here at Kaleidoscope. She has a wealth of experience working with people from a wide range of backgrounds, and she also has really sharp analysis skills and is a specialist in interviewing methods and thematic analysis of qualitative data. Sarah is going to take us through some common myths of qualitative research and help us understand why they are not true. Over to you, Sarah.
Yes, thank you very much. And thank you for the introduction too. And in addition to that, I've also cut my hair, so I look slightly different from my photo, if you were wondering. So now you've heard about how qualitative data can be effectively used to show impact and why it's so useful to have access to great qualitative data too. And now we're going to look at some of the common myths about qualitative research and try and bust some of those myths. And Gavin just gave some really lovely examples for some of the truths to those myths that I'm going to cover, which you will soon probably join the dots of. So the myths we've got are: qualitative data isn't scientific or rigorous. You need a large sample size for qualitative data to be valid. Qualitative data is weak because it's subjective. Qualitative methods can't measure impact. Qualitative data collection is just having casual conversations, and qualitative research is expensive and takes too long. So when you registered for this webinar, we asked you, what is one thing you hope to hear or learn in this workshop? And using your answers to that question, and also from your own experience, we use that to create these myths. So we're going to go back over to the Menti. So if you go to the next slide, please. So grab your phone or follow the link or join it however you did before. And we've uploaded those 6 myths. And this is your chance to rank them in order of priority of which you'd like to cover today. We won't have time to cover all, but the ones we don't get to cover, we will send over to you with the truths. So if you like to do that now, and then we will follow democracy and go into the ones which have the top votes. Just give you a couple of minutes to cast your votes. So qualitative data isn't scientific or rigorous. So if we could go on to the next slide. So the truth of that is that qualitative research isn't just guesswork. It follows some really strict rules and procedures with systematic, replicable methods, and it can provide really deep, context-rich insights that numbers alone might miss. So qualitative research can give us a really excellent understanding of the full picture and the small details, and it allows researchers to study complex situations in those real-world settings, and it considers all the different viewpoints and how the various different factors interact. And it can reveal things like the reasons behind people's actions and what they believe and what they've experienced, and those are the things that might not be obvious when you're just looking at the numbers, as I just mentioned. And yeah, they're established in really rigorous methods for analysing qualitative data, such as thematic analysis, grounded theory, content analysis. And these methods have been developed over, decades of research practice. And they're really good at identifying patterns, themes, and concepts within qualitative data. So thematic analysis offers a really flexible but also rigorous approach to identifying, analysing, and reporting patterns within data. Grounded theory provides a systematic methodology that aims to develop theory from data rather than starting with a predetermined hypothesis. And then lastly, content analysis is a smaller method of studying, written or spoken information by breaking it down into smaller, meaningful chunks. And it helps researchers find patterns and draw conclusions from much larger amounts of text. And all of these methods involve kind of multiple stages of coding and constant comparison and interpretation, which ensures a really thorough and systematic approach to data analysis. So that myth is not true. So moving on to the second one that you chose. So qualitative methods can't measure impact. Let me just find that. Yes, so qualitative methods absolutely can and do measure impact effectively. They can capture the kind of nuanced changes and unexpected outcomes and help to explain the how and the why behind those outcomes. So this approach, the approach that is qualitative research. It reveals important effects that numbers alone might miss, as I mentioned before, and it provides a really comprehensive measure of something's influence. So by using methods like one-to-one interviews, group discussions, qualitative research can investigate how one thing can lead to another, and it considers all of those surrounding circumstances and how individual experiences can contribute to that overall impact. So yeah, it can measure impact by, as I mentioned, capturing nuanced changes. So it can detect all those subtle shifts in attitudes, behaviours, or experiences that you might not be able to see from numerical data. It can reveal unexpected outcomes. So the open-ended approaches from the questions allow for the discovery of those unseen impacts, both positive and negative, and then explaining the how and the why. So qualitative methods help us understand not just what changed, but how and why those changes happened. And they give us the full picture, explaining kind of the reasons and processes behind that impact that we see. Another thing it does is give voices to participants. So it allows participants to describe the impact in their own words, potentially revealing effects that researchers hadn't anticipated. And then it also adds depth to quantitative findings. So it can explain and give meaning to trends observed in quantitative data if you're doing a mixed methods approach. And then also it can provide impact by adapting to concepts. So qualitative approaches can be tailored to specific cultural or social contexts, ensuring that the impact is measured in a really relevant and meaningful way. Looking at the time, we've probably got time to look at one more. So let's go back to the Menti. So third, you need a large sample size for qualitative data to be valid. Let me just... So yes, qualitative research often focuses on depth over breadth, and a small purposefully selected sample can provide rich, meaningful data and can be just as valid as studies with a larger sample size. So that myth is just a myth. So unlike quantitative research, which often aims to draw the broader conclusions that apply to many cases, qualitative research seeks to develop those deep nuanced understandings, as I've kind of been mentioning throughout all of the examples. And qualitative researchers really carefully choose which participants are likely to provide the most valuable insights for their study. So the goal is to gather rich, detailed information rather than having a large number of participants. So it's quality over quantity. And the quality of the data and the depth of the analysis are often more important than the number of participants, which is why a smaller sample size can be just as valid as a bigger one. And the small sample size in qualitative research is often determined by the nature of the research questions and the depth of inquiry that those require. So in qualitative research, you continue collecting data until you reach a point basically where new interviews and new observations aren't revealing anything new, and that's called saturation point. And this approach helps you have a thorough understanding of the topic without necessarily needing to expand the sample size. And as well as this, smaller purposeful samples can be more time and resource efficient, so can allow for much more in-depth analysis with the resources that you have available, basically. So that's a whistle-stop tour of 3 of the top myths, but as I said, we will send you the other ones with those truths, so nothing will be lost. And I hope that was helpful. I'm back to you, Andrea, now.
Fantastic. Thank you so much, Sarah. So we're going to move into Q&A. And for this, because we're a large group, again, we're going to use Menti to collect questions. And we also have some questions that you submitted during the registration process. So Joe and I will answer those, answer a few of those. And then, as I said, we'll be using Menti to collect any new questions or top tips you might have in qualitative data, something that's worked really well for you and you want to share that with others. Please feel free to pop that in as well. So we'll go ahead and do that. We probably won't have time to answer all of the questions today, but any question that you share with us today, we will take away and we'll answer in writing, and we'll share a full answers for the Q&A when we share the slides and the recording from this session. So if we could go ahead, if you could go to Menti, it's again, the link is in chat. Go to Menti and pop in any questions that you would like to ask or any top tips you'd like to share, and we'll give you a couple minutes to do that. But I'll go ahead and just start answering some of the questions that came through already. So there was a question about understanding the impact, or understanding how to improve measuring and reporting the impact of a strategy. So measuring impact of strategy can be quite a tricky thing. And so we'll go ahead and talk through how we would do that. So understanding the impact of your strategy program, it really starts with setting out the change that you expected to see. And to do that, you can use the theory of change to describe how the strategy is supposed to deliver better outcomes. If you want more resources on how to develop a theory of change, you could see our logic model webinar from last month, and the recording and slides are available on our website from that. It walks through a lot of top tips for how to create a logic model, and that is a really helpful place to start. And then once you have that developed, you can use qualitative interviews or focus groups or surveys to hear from people about whether and how the expected changes took place from your strategy, the factors that led to success, and if there were any unexpected outcomes. And then you can combine this with available quantitative data if you have any, for example, data like staff retention or reduced waiting times that are relevant to your strategy and the change you're expecting to see. And combining the qualitative impact that you've gathered through focus groups or data collection workshops, small group conversations, surveys can, with that quantitative data, creates really powerful evidence then of strategy impact. Also, I'll mention if you want help with strategy development or theories of change for your strategy or evaluating the impact of your strategy, please feel free to get in touch. You can get in touch through our website, or you can email me at andrea@kscopehealth.org.uk. We would love to have a chat with you about what your needs are and how we might be able to help. All right, Joe, can I hand it over to you? Well, we've got one question that's come through. We'll give it a minute, see if we get a few more. But Joe, could you take the question on helping stakeholders understand validity of findings from qualitative research? That was one that came up quite a bit in the registration.
Yeah, thanks very much. So how to help people understand the validity of findings? Oh, in quite a short one, let them know who's been involved and how they've been involved, where the information has come from, the numbers and the sample that you've taken. When you're presenting your information, make sure there's a clearly described method for how you graded the strength of evidence. So we talked about that sort of evidence strength earlier on. And if you're talking about one strength of evidence, include other evidence at that same level of strength in the same place. If you sort of jump around, it can get a little bit confusing. And use a consistent coding or signposting system throughout your report. And lastly, so we will know what the evidence is for each piece that you're presenting. And lastly, include a limitation section in your report. Be honest and open about what the limits of your confidence are in your findings. So yeah, if you include all of those, that's a good start. Back to you, Andrea.
Great, thanks, Joe. So I'll address another question that came through in the registration was about capacity planning for impact measurement. So one of the myths that is in Sarah's presentation, you'll see in the slides later, is that it can be really expensive. It can take a lot of effort to conduct qualitative research. And one of the questions that came through is how we can effectively capacity plan for impact measurement with qualitative data, and how can we minimize the admin burden. And a few people noted that just case studies can take a lot of work, take a long time. We at Kaleidoscope can certainly empathize with that. And it is true that qualitative research can sometimes feel like it's taking a lot longer than quantitative research, and that's something that is really important to plan for in advance. I would say it can also be done very efficiently, and if you can upfront before you start, really think that it's helpful to just start with a lot of clarity around your research framework. So as Gavin said when he was talking about the work we did with Healthwatch, that we started by co-developing a research framework that helped make sure everyone understood and everyone was on board and aligned with what the research questions were, what types of methods we were going to use to collect data, and who our target sample population was, and how we were going to reach that target sample population. And so there was a lot of clarity around exactly what we were asking, who we were asking, and how we were going to ask. And that helped us think about what's the most efficient way to get the answers to these questions and to make sure that we have the population represented that we want. So I think that's starting with that, investing up front in that level of clarity is really, really helpful and will save you a lot of time throughout the project. I would also say in that process, think ahead about your stakeholders and what will be most effective for getting across the key points to them. So do they need to hear from particular groups? Is a particular kind of subpopulations very important to make sure those are represented in your sample? Or is it that they're most moved by individual case studies and that's something you really need to prioritize? Or would short videos be most effective in reaching your key stakeholders? So think up front about who your stakeholders are and what kinds of what's important to them and how you'll best be able to reach them and what needs to be included in your research framework. Then I would say think about the most efficient ways to really get that data. One thing Gavin mentioned that we use for Healthwatch and we use a lot is small group conversations. We find that to be a really efficient way of getting a lot of data in a small amount of time. You can run those online to make it really easy and accessible for participants so they can join online. In an hour, you can get a lot of information from a representative group of people. That can be a bit faster than conducting one-on-one interviews, and it can provide more depth than surveys. So that's one way to do that. I would also say if case studies are important to you, just think about brevity. A 2-paragraph case study can actually be more impactful than a 2-page case study. And so think about ways that you can get those key points across and really get that kind of grounded in that real world example, but without spending days and days on a multi-page case study. Joe, I'll go over to you to take the next question.
Yeah, there was one which came through in advance about creative ways of using qualitative data to show impact for a charity, but it lines up with the what methods have you found most effective for communicating qualitative insights to stakeholders across the two. So as Andrea was saying already, and it's crossed over a little bit, think about your audience and how they might want to receive the information, and you can ask them. You can ask them, like, how do you want this information? What creative format? They might have something which really lands well for them. Some examples we've shown were sort of maps of qualitative data and videos, but particularly in charities, but outside as well, the voice of the people that you're supporting lands well. So outputs which literally have that. So stories of change that use a set of stakeholders or different voices, bringing those results to life, whether that's through short videos, verbally described reports, sort of verbally described pictures or cartoons or sort of reaction videos to your findings, that sort of stuff, and how what your findings mean to them, that can all land quite well, particularly in the charity sector, but elsewhere. The qualitative nature of collection and sort of the verbal qualitative delivery of the outputs really matches up well. Andrea, back to you.
Great, thanks, Joe. I'll just looking at the questions that have come through live. We probably have time to get to one, maybe 2 of these, and then what we'll do is we'll take away the rest of them. We'll answer them in writing, and we'll send that out with the slides and the recording post-event. So don't worry, we will get to all of these questions, if not in this event. So I can talk about this. There's a question here about how do you engage research participants in the dissemination and implementation of the findings. I think that's a really, really good question, and it's a fantastic thing to be thinking about at the beginning of any qualitative research study. So again, I would say it goes back to that planning that you do upfront in the beginning. When you develop your research framework, you can also develop a stakeholder engagement plan and think about who your stakeholders are. So that includes the research participants, the people you hope to include in the sample. It also includes people who you want to get to have the findings at the end, or you want to be influenced by the findings. And so thinking about who those people are, and then pulling your research participants in as potential disseminators of your research, which you can do through a few different ways. One way is that you can set up a sort of participant advisory group. So you can set up a group of a subset of your population sample that help advise you on your research framework. You can test the questions with them. You can test your dissemination methods with them. You can sort of make sure that you're reaching the populations you want to reach. You can test your findings. You can take your findings to them and say, do these ring true? Are we missing anything? Do there seem to be any gaps here? So setting up a kind of participant advisory panel can be a really helpful way to do that. And then you have champions of your research already to go who will help you get it out through their networks, their channels. And so that's, I think, a really good way to go. let's see, Joe, can I hand it over to you to take one more and then we'll go ahead and wrap up?
Yeah, sure. A quick one. What sort of challenges have you had and how have you handled them when senior managers have been dismissive of qualitative research? Absolutely. Yeah, that's something we've definitely experienced. People saying, yeah, that's just like your opinion, you know. And we've approached it in two ways. One, we create really succinct, punchy slides which describe our methods. You know, this is a representative sample that we've taken it from. We place the sort of people's views in the context of how strongly they've been heard, whether they've triangulated it across multiple sources. So explaining the methods in a very clear way, which backs up your findings. But then the other way, involving those senior managers in the data collection process. So they're one of the key stakeholders that you're getting information from, by letting them see from the inside what it's like to take part in that data collection process. They then value their outputs, which go into your qualitative research, and they're more likely to value other people's as well, either in an individual interview or through a workshop as well. But yeah, very short, but yeah, back to you, Andrea.
Great, thanks, Joe. All right, if we could go on to the next slide. And as I said, we'll take away all the questions that you've shared and we'll provide answers with the recording of materials. All right, so we're going to check back in on comfort level and see if it's changed at all through the course of this webinar. If you could go to Menti and just let us know now, an hour later, on a scale of 1 to 10, how comfortable are you with conducting qualitative research and using qualitative data? So it looks like it's jumped right up, but as people enter data, we might see that change. So we'll give it 10 seconds, get your numbers in. And it looks like it's hovering right around 8. All right, oh, gone down a little bit, but we're still in the high 7s. Fantastic, we'll take it. That's an excellent change from where we started at 6. So we've done a pretty significant jump there. So I hope that the tips that we have provided over the last hour have helped increase your comfort level and helped you feel more confident about using qualitative data and designing qualitative research. So if we could just go to the next slide, please. Just as a quick reminder of our consultancy services in research evaluation, strategy development, service change, organizational development, and collaborations and system support, please do be in touch if you think we could help you with any of these or you just want to have a chat. We would love to hear from you. You can contact us through our website or you can email me directly. And also want to mention, if we could go to the next slide, please. That, as I said, if you get in touch for a coffee, you can sign up for our newsletter, and I believe the link for that is in the chat. And we'd love to have you join us for another event. Our next event will be on the 19th of September, and we'll focus on leadership in a mental health setting. The registration link is in the chat, so please do use that and join us for that event if you're able.